I'd like to take this opportunity to thank everybody for coming out this evening. It's a little smaller crowd than we're used to, but I'm glad that you're all here and interested in the presentation that we have for you this evening. The volunteers have done a lot of work putting this presentation together for you. Ralph Guevara is here, who helped put it together with the iVantage group. We look forward to hearing your questions. If you don't feel like stepping up to the mic and asking the questions, we do have some cards. You can write your questions down. The volunteers will gather them up and we'll answer them for you. So why don't we get this meeting started, and I'll turn this over to Jim Chayosis.
So most everybody has been here from July to date, but what I want to first do is introduce everybody that has been working for the last 6 or 7 months on the St. Andrews Task Force. The governing members of the task force, as agreed by that 4-town interlocal agreement, have been Chuck Cunningham from Boothbay, Valerie Augustine from Boothbay Harbor, Smith Climo from Southport, and I understand that Smith is not feeling well, so hopefully he feels better, but he won't be here tonight. So. Good thoughts and best wishes to him. Stuart Smith from Edgecombe. Now these 4 elected officials have worked pretty diligently over the last few months in making sure that we're organized and on task. But who's been doing all the work? A bunch of key volunteers that get very little recognition but put in tons of hours, and I want to just go over their names real quickly because they deserve a little recognition for the effort that they put in. And this is not everybody. These are just the key volunteers that have really pulled a lot of weight. But Tom Berry, Helen Farnham, Chris Haskell, Freddie Luke, Fran McBeardy, Tom Perkins, Peggy Pinkham, Pam Reed, Patty Siebold, Mary Conley, Tom Hagan, Dorothy Hurt, Representative Bruce McDonald, Mike Pander, Margaret Parrott, Rick and Peggy Powis, Sandra Rumry, and Tom Tavener. Now all those people have really pulled a tremendous load. So when you think about what Patty is going to go through this presentation and we get to the questions and answers and all the information that's been uncovered in the last few months, where did that come from? It came from those people that I just listed off. They've all done a lot of work. In order to fully respect the presentation that Patty's going to give to you, you kind of have to start over from square one. And so I'm just going to recap how we got to this point, even though everybody that reads the Boothbay Register or watches Channel 7 has probably been pretty well informed. So July 2012, the public officials of the 4 area towns were invited to a briefing of some healthcare changes that were going to happen at St. Andrews Hospital. The exact prescription of what was going to change in services got leaked out a couple days in advance, and it piqued the curiosity of those public officials. And you probably saw my face on TV with comments a few times at the direction of our Board of Selectmen. They're a little concerned at the way those services were being announced. So what happened is we had a joint selectmen's meeting in August 2012. And if this seems like it was only a few days ago, it's because it really was. It was only a few months ago. We had a joint selectmen's meeting in here, and some of the faces that I see here tonight are the same people that were here that night. And we knew absolutely nothing about what we were doing. We just knew that we wanted to get together and talk about the service changes that were happening at the hospital. What we decided to do was form a task force to look into the service changes, to collaborate, because this was obviously something bigger than any one town, and try to come up with some order to what we can do and what we should do. And then quite a few things happened from there. We hired Kozak and Gayer and Julia Sombranowitz, which everybody met here in this same room at one point in time, and we found out what a really talented lawyer Julius is, and how great Kozak and Geyer is. And then we started doing some information collecting. And if anybody's been to the library or the Booth Bay town office, and you've seen the stacks of information that we've collected, anything from surveys and studies of healthcare that may be related to the issues, or financial information as it pertains to St. Andrew's Hospital, Miles, Lincoln County Healthcare, Maine Health. All of that is in the Town of Booth Bay library, and sometimes it looks a little cluttered because we don't know how to organize that stuff, but we're getting better at it. Then in September, one of our most dedicated volunteers, Peggy, has started figuring out what do we have for skills amongst these volunteers. We're kind of a mishmash, and Peggy brought a lot of order to the people that we had volunteering to do services, and we found out that the skill sets amongst our volunteers, that we had doctors and lawyers and CPAs and hospital administrators and talent that you wouldn't ordinarily get from an ordinary stand-in board of the Town of Booth Bay. This was a unique situation and got a lot of talent. And after we organized that, we really started to get some traction. And then in about October, Julius and Kozak and Geyer published the position paper of the task force, which hopefully by now everybody's had an opportunity to read through. It's a very, very good paper, a lot of meat to the matter, and if you haven't seen it, it's on the website that we've established for the task force, and it's also attached to the Town of Booth Bay website. I have it here tonight, but obviously that's not why we're here. And then also in October, the Booth Bay Region Ambulance Service preliminary budget came out, and obviously that was a shock. There quite a substantial increase in the budget to the ambulance service, pretty much a multiple of 5 increase to the ambulance service cost. Also in October, the task force started meeting with Lincoln County Healthcare and Maine Health, trying to find some common ground. Dialogue has always been the easiest way to settle disputes, and we thought that might have been the direction that the task force would go in. November came about, and we had our second public meeting in here. A lot of people got to meet Julius, you get to hear Julius, and we announced that we were entering into a contract with iVantage and Ralph Cabarro. And Ralph's here tonight, and hopefully by now everybody's seen the paper that they put together that really looks at the viability of the hospital and analyzes some of the assumptions that were done in the Navigant report, which is the commission study that Lincoln County Health and Maine Health put together. It's a rebuttal study. It really is in a lot of ways. That was not why iVantage was hired, but that's what they found. Then also in November came out the Community Speaks paper, which is also attached to the website, attached to the Town of Booth Bay website, published by the infamous Patty Siebold, who will speak in a little bit. So you see what we've done is we created 3 really credible documents by 3 really good authors on this subject. So the task force has not been a bunch of bees in many directions. They've been working on the issue. In January, the iVantage report was released, and that also happened to be the conclusion of the meetings with Lincoln County Healthcare and Maine Health. That seemed to be where the roads diverted. And so now we're here in February, and you're going to get a briefing from Patty Siebold on the iVantage report, and essentially what they have keyed is the second opinion, which I love the irony in that title as a second opinion, because that's what you would go to a doctor for, right? Another doctor is another second opinion. So let me introduce one person before we get to Patty, and that's Jane Good, who is one of the key volunteers I referred to. Thank you. Jane.
Well, I'm glad to see everybody here this evening, and it's a good crowd. We've got a lot of information to share with you, and it's been a pleasure to work with this group right here. But first of all, Jim asked me to speak a little bit about the Attorney General. And I don't know if any of you know, but I'm just going to start from scratch. I had written a letter to be presented to the Attorney General, and it's taken off like wildfire. The only place it could be distributed at first was at the town hall in my home. And I asked the task force to go home with 10 letters themselves. And that would give us, there were about 30 regular members, so that would give us 300 letters right off the bat. Well, I had 400 right off the bat. And people were calling and asking. I've had businesses downtown who have started to call, and they want to put the heart, if you see the red heart that says Save St. Andrews in any store window downtown, then you know that they carry these letters. Grover's called today. They were out. They had 25. They need 25 more. It's really exciting. And the thing that makes me the happiest about this is that this really gives us a voice. I feel oftentimes that this was something that was done to us, but we have a voice and we have power. And it's important for the Attorney General to know that. I've had people write letters on the bottom, heartfelt letters. This is a way we can heal in our community. We need to do this anyway. So I'm very happy with it, and I would like to tell you that I was fortunate enough to be in on the Attorney General's meeting, and it was quite an experience for me. As I said at our meeting, it wasn't on my bucket list, but guess what? It was pretty thrilling to be there with her, and I gave her a list of 400 letters, and the front page article in the paper with her bill underneath it, and her face lit up like a Christmas tree when she saw that. And we're going to try to follow up and follow her bill and help her with that too from our cause here. But there were, at that meeting, Bruce McDonald was present, and he initiated the meeting with her, and Tom Barry, myself, Margaret Parrott, Mike Pandor, and Jim Chaosis. And what I will say about that meeting was that I thought they were very well versed on our situation, and they asked tremendous questions. It was a Christina Moyen, thank you, was at the Attorney General's side, and they were very well versed. They knew our situation. They asked really good questions. We gave them really good information. I felt proud to be there. The 6 people who were there gave it their very best shot. And when we came out of there, we said, could we have done anything different? And we decided we couldn't. So I feel really good about it, and I feel strong about that. So we'll keep that going. If you haven't signed the letter tonight, if you would take 2 or 3 home, everybody's got a neighbor or a family, or let's keep this thing going. I have another stack of 200 at home, and when I have another 400, we'll present some more to her. So it's a way to keep this thing going. Thank you. I guess a little bit about myself, that I'm a small business owner on Southport. I was born in Holton, but I grew up in Gardner, and I've lived here for about 35 years. Back when my daughter was in school, I led a 10-year integrated effort from the peninsula to tackle substance abuse, if some of you might remember it, which was the C Team. And I've also been involved with the domestic violence group New Hope for Women as an advocate and also as a telephone person. I'm a member of the Community Hospital Group. We've been working together since fall to gather the health and the wellness needs of the people of our peninsula and to learn from the other hospitals in rural areas in Maine the questions our group have been trying to have answers. Some of the questions we worked on are, what kind of health care and wellness services do we need on this peninsula? And what services can we cost effectively deliver to fill those needs? And what role should our community hospital, St. Andrews, play? At this time, I'd like to introduce the members of our team. If you just would stand for a minute so people could see who you are, that would be great. Margaret Parrott, to my left. She's a former executive director of Rosewell Foundation and a former assistant to the Dean of Women in the Virginia Commonwealth University. She's a resident of Boothbay Harbor since 2007. And she's my partner in crime. She keeps me going. Thank you, Margaret. Dan Jameson. Dan's a retired military. He's a HR executive at the Raytheon, specializing in labor relations, negotiations, and volunteering as a mediator in the Maine Attorney General's office. Thank you, Dan. Sandra Rummery. She's a former nurse manager, Department of Mental Health, Massachusetts, and a consultant to ER clinical teams. Thank you, Sandra. Tom, a businessman. He's currently the CEO of his third company, Actioneer Software for mobile phones, and a former chairman of the board of a Boston-based nonprofit, National Braille Press. And I'd like to acknowledge two former members of our working group who contributed an awful lot of effort before they had to move on. And one is Dorothy Hurt. She was an RN, emergency room nurse in the community hospital in Nebraska, who has also led the organization's qualities program and who worked as a visiting ER nurse in Florida. Dorothy scheduled and organized all the site visits and participated in all but the last two. It was a tremendous amount of work. She sent us all information on the hospital before we went to visit it. She made all the appointments. She scheduled time-wise. She was incredible. She knew at MapQuest how long it was going to take us to get there. And we're going to miss Dorothy. And the other person is Fran McGreedy. Before moving to Boothbay, Fran worked as an internet company, Cisco Systems, where he oversaw the integration of IT systems for the acquired companies. And he's very active on a number of projects on the peninsula, and he also works as a mediator at the Attorney General's office. Fran was also an active participant in the site visits in the fall. Now, the on-site visits that we went to, we went to 11 critical access hospitals. And these are the hospitals that we visited. And some we had conference calls with as well. But Blue Hill, Bridgeton, C.A. Dean in Greenville, Holton, Machias, Dover Foxcroft, Mount Desert Island, Penobscot Valley in Lincoln, Reddington Fairview in Skowhegan, Rumford, and Sebasticook in Pittsfield. So you can see, we really traveled some miles and to research and to get some of our questions asked. Last but not least, I'm really quite proud that I can introduce Patty. Patty and her husband, Tom Hagen, have lived in Boothbay for 27 years in the old YMCA Back Narrows Road, if you're familiar with that. She's best known for her best-selling books, Customers.com and Customer Revolutions and Outside Innovations. She runs a small Boston-based consulting and publishing company to help businesses deliver a better customer experience and to co-design products and services with their customers. Her current paying clients include GE, Citicorp, Hewlett-Packard, and her current pro bono clients are people from the Boothbay Peninsula. And this is really special about Patty. In addition to traveling for businesses, she travels to Uganda twice a year, where she serves on a board of the African Rural University, the first all-women's university in Africa, and that's really commendable. I guess I would have to say to Patty, she's just been a great leader. Sometimes we have to rein her in because she's such a forward. She's way down the road. She's forward thinking. She's ahead of us sometimes in our steps. But we just holler, slow down, let the rest of us catch up with you. It's really fun to watch Patty work. She's so professional. And her questions while she's interviewing somebody, they're always just so polite and they're so straightforward. She's just has a command of language and her listening skills are impeccable. It's wonderful for me to watch you work. And she asks many questions until she's clear about the ones that she's answered, and she is a seeker of the truth. We've all been trying to find out about the truth in this situation. And she's one of the hardest working women I've ever met in my entire life. She gives 200%. She's a woman of great integrity, and I feel blessed to know her. And the task force is blessed that she's found us. So, thank you.
Thank you. Okay. Well, I think that's going to be a hard act to follow here. But I appreciate all of you coming, and I really am delighted also that we have a lot of people I know are going to be watching on Channel 7. And I want to give a shout out to some of the people who will be, who weren't able to be here tonight and will be watching, and that includes the executive teams of these 11 hospitals that we met with. Thank you very much for spending your time with us. And also extended to those hospital executives at all of the 11 hospitals that Jane mentioned, there are other medical professionals that are connected to them at the University of Pennsylvania, the Perelman Center. I think they're going to be watching this with great interest. And the trauma doctors at Mass General are also involved with a number of the hospitals. So this isn't just about us in Boothbay. There are people all over the country that are actually watching what happens here. One of the CEOs said to us, you know, you guys are the canary in the coal mine, because if you let your hospital go, then we're going to be next. So they are all rooting for us. They want us to succeed. They want us to have a rural hospital that is viable and to be able to keep St. Andrews going. So the point of our second opinion presentation is to kind of pull together a lot of what we've learned, including all the good work that Ralph Gabaro and Scott Goodspeed at the Advantage organization did. And just to remind you, Jim went through the timeline. You know, the first opinion was when we heard from Lincoln County Healthcare that most of us through the register, Boothbay Register, that our hospital was going to be closed and they were going to substitute an urgent care clinic, a daytime urgent care clinic. And we'd lose 50 jobs. And all of us, I think, were just shocked. That's why there was a huge outpouring of people in this room in August, and we were all standing there, you know, feeling completely shell-shocked, because usually if there's going to be that kind of a change in a community, we would have been involved. We should have been involved in the whole discussion about, you know, why isn't the hospital viable? Why do you think there's a problem with it? Let's work together to figure out how we can make it work. And that isn't what happened in this case, as we all know. And as we heard from in reading the paper and heard from Julius directly when he came, from a legal standpoint, we all still feel that what Lincoln County Healthcare and Maine Health are doing in closing our hospital is actually probably illegal and certainly immoral and very much unethical. And that has to do with the fact that in the Articles of Incorporation for St. Andrews, it has always said that the purpose of St. Andrews as a charitable nonprofit is to establish, operate, and maintain a public hospital for the people in this community. And there have been, as you know, many changes, management changes and the affiliation with Maine Health and then the subsequent affiliation with Lincoln County Healthcare that have happened over the years, and yet that part of the Articles of Incorporation has not been changed. The purpose is still to keep it as a public hospital. So the decision to close it is actually contrary to the stated purpose of the charitable organization that was chartered by the state of Massachusetts, state of Maine, sorry, which is one reason we feel the Attorney General is quite interested in our situation. And as Julius said, this is a violation of law and a breach of trust with the state, with St. Andrew's supporters and benefactors, all the people who contributed money to this nonprofit, and of course to all of us who live in the communities. Now, what I'd like to do is ask for a show of hands. How many people in this room were born at St. Andrews? Okay. Anybody died at St. Andrews? Not yet. How many of you, again, a show of hands, how many of you have either used a service at St. Andrews and or know somebody in your family or friends who have? Could we get another? Oh, look at that. Okay, no wonder. Okay, what I'd like you to do is just take about 2 minutes and turn to the person in front of you or next to you and just spend a couple of minutes sharing, just talking briefly about that, one of those experiences. I want us to kind of get in touch with what was St. Andrews like for us. So just spend a couple of minutes talking to your neighbor about your experience with St. Andrews. You to have a chance to just realize that we all have this in common. That's part of why we're here. This hospital has served us all really well. Now, one of the things that I'm sure that you've heard or read about in a lot of this stuff is this phrase, critical access hospital. One of the things that Lincoln County Healthcare is doing when they close the emergency room is they're actually causing St. Andrews to no longer be a hospital. And the reason is that right now St. Andrews is designated by Medicare as a critical access hospital. It's a very important designation because it means that we can earn more money for the services that we provide, and it's a designation that was specifically designed for rural areas, for people who need to have access to health care but may be sparsely populated, living in a sparsely populated area. So what does it mean to be a critical access hospital? Well, first of all, you have to have a 24-hour, 7-day-a-week emergency room in order to qualify. So as soon as that gets closed, we are ineligible. We can't be a critical access hospital. The other criteria are that you have to be small, no more than 25 beds, and these beds can be used for acute care or for nursing care. And if you, so let's say you end up at the emergency room and you've got pneumonia, and then they're able to make you feel better, and they put you in a acute care bed, and you have skilled nursing services, and then you're beginning to feel better, but you still need some rehab and some work on pulmonary function and some other things. So then they would keep you, you'd still be in the same bed, but it changes from being acute to being just what they call a swing bed, where you're taken care of and you can easily get to the rehab and get additional services that you need. So that's kind of the way it works. And of course, some people may just come in for skilled nursing as well, or some people come in because they're at end of life and they need palliative care. So, as I mentioned, St. Andrews has critical access hospital status, and essentially it's being thrown away by the management team at Lincoln County Healthcare deciding, well, this isn't cost effective, so we're going to shut it down. And that's what we're all here about. That's what we're fighting about. That's what we're saying, no, that's not okay. And this is why. You know, everybody says, well, it's really only 18 miles to Miles, so why are you guys complaining about it? But that's not actually true. And, you know, what's more important than the miles is the time, that golden hour. And actually, one of our task force members, Smith Climo, had a medical incident just this past weekend and ended up going to St. Andrews and then being transported to Maine Medical, and he needed to have that first stop to stabilize him, make sure he was okay, make sure that they could then take care of him and transport him. So the ability to get that care, that critical care, when you're having a heart problem, when you're having a stroke, when you're having something like that, is absolutely essential. And if you live at the tip of Southport or Ocean Point, it's 41 minutes to get to Miles, and that's once the ambulance gets to your house. So we're getting pretty close to that golden hour. And of course, we all know that there are many times when getting up Route 27 and onto Route 1, let alone trying to hop across the River Road, is not really, you know, it can be blocked by traffic, it can be blocked by snow, it can be blocked by tourists, and it's very difficult. So we are in a rural, inaccessible area, and that's one of the things that makes us different. And of course, we also have islands and people out at sea that we're serving from our hospital. Now, another reason that having critical access designation is really important is that, remember I mentioned that this is a Medicare designation. And if you look at the population on our peninsula, 62% of us are either at Medicare age or almost at Medicare age. So having that capability to get higher reimbursement from Medicare for taking care of the people who already live here is pretty important. And the reimbursement is 101% of reasonable costs, which actually comes out for a hospital of our size to about $1.5 million a year in revenues that would go away if we were not a critical access hospital. So that's important. So the first opinion that Navigant, the Navigant report, of course, was the one that said, we're going to close down the emergency room, we're going to put in a daytime urgent care center, and then they also said we should move all surgeries, inpatient and outpatient, to Miles. And that actually has been done. That was done, the last surgery was in April. And then, of course, forego the critical access status. And what that means is we will no longer be a hospital as of October 1st. And as you know, that was supposed to be April 1st, and we won a stay of execution, mostly because the ambulance costs, which we'll talk about in a sec, really needed to be figured out, how we're going to pay for those as towns. So, in addition to the critical access hospital losing that designation, one of the things that's very clear is that Lincoln County Healthcare didn't think about the cost to us of the increased ambulance service. From their standpoint, it's not on their budget. It's not something they need to worry about. They don't pay for the ambulance, but we do. It's a volunteer ambulance service, and it's supported by all of our taxes from each of the 4 towns, allocated based on how much we use it. So the fact that they didn't take that into account is pretty important. And another thing they didn't even think about is that not having a hospital actually impacts the value of our real estate. I don't know how many of you have noticed, but I've actually talked to quite a few people who were planning to buy retirement homes here and are now no longer. I've also talked to people who have moved out of the community because the hospital was gone. And I've talked to a number of realtors who have said, yes, it's true, it's harder for me to sell a house when I can't tell people that they're going to have a hospital in the community. So basically, Lincoln County Healthcare thought about their own budget and what made sense for them strategically. And also they thought about Lincoln County Health, they thought about Lincoln County as a whole, but they didn't think about these externalities of the things that really impact our pocketbooks. So, as I mentioned, the ambulance costs now, As Jim said, we got the first glimmerings in October that the price was going to be much higher, and it's actually the cost to beef up our ambulances, to hire more people, to train more people, and to be able to basically take people from their homes 2 miles or somewhere else and be able to have trained paramedics and EMTs. That's 500% higher than it is today. And that's going to, and it's allocated across the 4 towns, but it's basically going to go up to $414,000 to $320 per year, this coming year, per year. So think about it, $400,000 of additional money that we all have to come up with out of our pockets through real estate taxes. That's $4 million in 10 years that we're going to be paying because they want to shut our hospital down and have us bear the burden of paying for additional ambulance capability. Now, I mentioned real estate, and it was my husband Tom who said, well, let's take a look at, since Ralph and Scott, you know, found out that, yes, it is true that real estate values are being impacted already by the fact that the hospital is leaving town or is going to be closed down. Tom did a little research and he said, okay, well, it looks like all of the real estate on our peninsula, total value of that is $2.5 billion. And if the real estate values dropped only 1%, then that would be $250 million of value lost from our peninsula. But the chances are that they're actually going to drop more than 1%. So think about it this way. If your house is worth $250,000 today, and before St. Andrews closes, you need to subtract $2,500 of value for each 1% that you think is going to be lost in property values. So this is where I'd like you to take your little white cards that we're also going to ask you to write questions on, and just spend 2 minutes thinking to yourself or talking to your neighbor, what do you think the percentage will be of the drop in real estate values, and just write that in the corner of the card, and then we'll collect them, because we're really curious to know what you guys think. Over dinner the other night, we were talking to some friends, and we just went around the room, and one person said, oh, I think the prices are going to be about 5%. Another one said, oh, I think it's going to be more like 20%. Somebody else said 15%. So take a minute and just think, what do you think? The property value, what do you think the impact is going to be on your property value or in anybody's property value of living in a community that no longer has a hospital? We've been talking about money. Let's talk about the other side of money. How much are we worth as customers to Maine Health, to Lincoln County Healthcare, to our health insurance companies, to the drugstores that we get our prescriptions from, to the pharmaceutical companies that make those prescriptions? Well, according to the state of Maine, we're each worth $8,500 a year. That's how much we, on average, spend on health care every year. Think about, you know, your health insurance costs, whether it's your supplemental insurance, Medicare, what Medicare pays for your costs for your service, and what you pay out of pocket. It's $8,500 a year per person, and if you look at the population, our total year-round population is close to 7,000 on the peninsula. And then, of course, we also have summer people who turn up, about 21,000 of them, for 4 months every year. So if we add them in, and we just average that out, we end up with a total average population of 14,000 people on this peninsula. And if you do that arithmetic, you end up with $119 million every year is what we're worth. So that's worth knowing. You know, this is not trivial. And it's certainly enough to afford a good rural hospital. And St. Andrews has been running with revenues of about $20 million every year. So there's a lot of money that's going to places other than St. Andrews, but it's certainly, we've been able to afford that. So a lot of people think the reason St. Andrews has to be closed is because it's a financial basket case. And one reason people think that is because back in August in the Boothbay Register, there was an article that said that from 2001 through 2008, St. Andrews reported operating losses for every year except one. And everybody says that. You bump into somebody in the store and they say, well, but St. Andrews loses money. So what I want you to think about is the fact that operating losses on a not-for-profit are only part of the picture. A not-for-profit means it's an organization that gets revenues from two sources. It gets revenues from services and it gets revenues from contributions, charitable contributions and donations. So there's actually gift income that makes up the difference, and there are many hospitals that are either running just break even intentionally because they're not-for-profits and they're here to serve the community and they're not here to gouge people by charging high prices, and the charitable contributions and or the bequests and or the money somebody donates for an operating room or whatever are the things that make up the difference. One of the things that's interesting to note is that in the 4 years since St. Andrews has been part of Lincoln County Healthcare, the contributions have dropped dramatically. So here is the situation. This is the last 11 years of St. Andrews. And notice the revenues, as I mentioned, around $20 million. Is what it's been. And if you look at the bottom line, so this is not operating losses, gains or losses, but net gains or losses. So if you take the revenues from services and the revenues from contributions together, what you see is that, yes, there were a couple of years, actually 4, where St. Andrews had a net loss. But there were also 8 years when it didn't, and its average net gain is $550,000 every year. So it's not a financial basket case. If run, it can certainly be run profitably and viably. Now, if you think about charitable contributions as part of the revenues for any nonprofit, let's take a look at how St. Andrews, here on the bottom right, compares to the amount of contributions that all the other major nonprofits have on this peninsula. So the Boothbay Region Land Trust, we all know and love, 93% of that income comes from our gifts, our charitable contributions. Coastal Botanical Gardens, 78% is supported by contributions. The Opera House, 74%. The YMCA, well, we have memberships, so 35% of that revenue comes from our memberships, but 65% comes from gifts that have been raised. And then we look at the ambulance service, and I've lumped here as gifts the money that our towns, when we vote, allocates to the ambulance service. So there's the checks we write when they come around and collect contributions, and then there's also the allocated money that comes from each of the town coffers, and that ends up being about 23%. And these are averaged over the last 4 years, and St. Andrews is at a measly 3%. So I think one of the questions you should be asking yourself is, where are priorities? You know, what are we really thinking in terms of what's important to us? I don't want to take anything away from all of these organizations. I think they're all valuable and worthy, and it's the quality of life that brings us here. But one of the things that every CEO that we talked to at every single hospital said was, the thing that's going to make a difference for you is the support of the community. If your community doesn't support your hospital by using it and by contributing it to it, then you might as well just pack up and go home. Now, all of those 6 not-for-profits actually together bring in contributions of about $6 million a year. So there are, we certainly have enough money, philanthropic money on this peninsula, both from year-round people, summer people, and grants and other ways of getting and bequests to support a predictable flow of $6 million a year, again, for the past 4 years. And that bump you can see were the Beausarge donations to the Botanical Gardens and the YMCA for the new pool and the new buildings. So those are aberrations, very nice ones, but I think you can see that we can clearly support a $6 million revenue stream from contributions. So bottom line, and what we heard from Ralph Gabarro and from the iVantage report, is there's actually no good reason to close this hospital. It should stay open. And they couldn't find, after looking at all the data, which we're going to look at in a minute, any compelling reason to move forward with the changes currently proposed for St. Andrews. And yet when we presented this information to the Lincoln County Healthcare Board, they said, well, we don't see any reason to change our minds. So let's look at this a little more carefully. So this is a graphic that shows the visits to the emergency room by time of day. So we're looking early morning, then we get to 8 a.m., and then late night. And you notice these large yellow numbers here are the ones, all the people who turned up in the ER at night during the hours in which it would be closed. There would be no service, there would be no urgent care facility. And so that's basically 20% of the visits to the ER actually occur during the night. And of course, many of those are fairly severe. And I suspect in the little stories you told to each other, some of them may have related to that. And as Ralph Gabarro pointed out in his study, if we were going to use low utilization, the fact that on average 0.6 people turn up at our ER every night, then you would actually probably have to close every critical access hospital in rural Maine, because they are designed to serve communities that have low volume, low traffic. And it's just, it would be like saying, well, we don't need a fire department, because after all, we don't have a fire every night, so why do we need a fire department? Well, that's what the ER is, right? It's the equivalent of a fire department. You don't want to go there, but you sure want it to be there when you need it. So, just back to money, so we talked about saving lives and being within the golden hour, but let's just total up all the, what this all means to us from a bottom line standpoint. And it comes out to the fact that it's going to cost us, we the people, we the customers, we the patients, $3.5 million per year out of our pockets. We're going to lose that $1.5 million a year in revenues from being a critical access hospital. We're going to lose another $250,000 a year from reduced fees at the Gregory Wing, because we don't have a hospital, so we can't charge the higher skilled nursing rates. We've already talked about the increased ambulance costs of $400,000 per year that's going to be paid for by our real estate taxes. We're losing all those jobs. That payroll is about $1.35 million. And we're also going to lose value on our real estate, if you agree with that assessment. So why does this make sense? It doesn't. Now, the other thing that Lincoln County Healthcare said when they decided to close us down is that, well, nobody is using the services at St. Andrews. So in addition to, not having very many people have heart attacks in the middle of the night, we're not going there to have surgeries, we're not going there for clinics, etc. Well, why is that? That's because they all got taken away. since 2007, 2008. So we no longer have surgery, inpatient surgery. We no longer have acute care. You can't, in fact, I remember talking to one of a gentleman from St. Andrews Village over the Christmas holidays, and he had had 3 bouts of pneumonia in a month, and every single time they took him to Miles. And I said, why couldn't you go to St. Andrews? And he said, I don't know, they just took me to Miles every time, and he kept ricocheting in and out. So that's the kind of thing that should be there that isn't. And then they took away outpatient day surgery and all of the specialty clinics. We used to have oncology clinics, diabetes clinics, orthopedics, urology, and we used to have chemotherapy in the infusion center, and that's gone. So all of these have been taken away, and then we're told, well, you're not using it, so we're going to close it down. And the Family Care Center, which has our physicians, our 4 physicians and our physician's assistant, whom we rely on and trust and love and value, but that's actually run not by St. Andrews, but by Miles. Those are the people are, that the bills come from Miles Memorial. So notice what happened when in 2009, so Lincoln County Healthcare took over in 2008. In 2009, there were 226 inpatients at St. Andrews, and by 2011, we're down to about 10. So you can see that dramatic drop. And then notice that, however, that not all of these patients didn't all end up at Miles. They actually went to Maine Medical, they went to Midcoast, they went to Lewiston, they went other places as well. And I thought that was a pretty interesting finding that you guys came up with, Ralph, was, you know, I don't really care about the market share for Maine Health or Lincoln County Healthcare, but they do. And notice that as St. Andrews services declined, so Maine Health actually lost market share because many people went elsewhere. They went to the competition. So St. Andrews lost patients, Maine Health lost share. So when we think about this 4-year experiment, which is what I like to call it, of St. Andrews and Miles and the Lincoln County physicians partners merging together under the umbrella of Lincoln County Healthcare, and we say, did this work? It was actually not so bad when we were just under Maine Health, but now we've got Lincoln County Healthcare and they pulled it all together. Who benefited? Well, Maine Health didn't actually benefit because as they shut down our stuff, we voted with our feet. And many of us went to Midcoast or Parkview or Lewiston. And Lincoln County Healthcare and Miles had the same problem because, again, some of us go to Miles for certain things, but a lot of people are turning left when they get out onto Route 1. And of course, we didn't benefit because all those services that we used to have, so you could just go down 10 minutes and get your blood test, or go get an x-ray locally, or you know, have your chemotherapy locally, or have orthopedic surgery, or anything right there, those are all gone. Now, to be fair, if you look at all of the national trends, one of the other things that Maine Health and Lincoln County Healthcare tell us is, well, inpatient hospitals is not where the action is anymore. Everybody has moved to outpatient. Most surgeries now are things that you can just go and do as an outpatient, you know, during the day, and then you go home and recuperate, and maybe you have some therapy afterwards. Not everything, you know, big hip surgery, you probably wouldn't be like that. But there are a lot of things now that can be done with outpatient visits. And there is a big shift. And we're not fighting that. We're saying, yes, that's true. So therefore, and there's going to be an increase in outpatient services required over the next 5 years, according to Ivantage and Gabaro. So what does that mean for us? Well, it means we need more outpatient services here, not less. And if you look at the people on this peninsula, again, from their report, there were 28,000 outpatient cases for the people who live on our peninsula in 2011. 28,000 people needed. Now, an outpatient case may be, a single thing. It might be a lab test. It might be an EKG. It might be surgery, ER, and then all these diagnostic outpatient visits. And that doesn't include the 21,000 people who are here for 4 months of the year, right? So there's a huge amount of actual demand for outpatient services on our peninsula. And then if we look at inpatient stays and we say, okay, so outpatient is much bigger and we need a lot of that. But it's also true that for our little population, year-round population of 7,000 people, there were 700 people on our peninsula who needed inpatient stays last year. And this is the frequency, so you can see, and I highlighted mental health because it's come up as one of the problem areas on our peninsula that's highly underserved, and one of our strategic directions is to make sure that we figure out a way to provide more mental health, proactive mental health coverage so that people don't end up being hospitalized because of that. So, and again, this doesn't include the data from our seasonal visitors. So you can see there's demand. We may be a small population, but 10% of us actually needed inpatient care last year. So St. Andrews can and should continue to provide 24/7 ER service, the ability of an ambulance to deliver patients to St. Andrews, which goes away once it's no longer a hospital. An ambulance can't take you there. They can only take you to another hospital. So we need that. We need inpatient acute care. We need skilled nursing and swing care, and we need our outpatient services restored. And then what about the ER? I mean, one of the things that people have said about our emergency department is, well, it's too expensive. We have these high-priced doctors. They're there 24 hours a day. So when we went to visit all the 11 hospitals we went to see, one of the things we asked them is how did they staff their emergency rooms? And they gave us several different kind of patterns, and that you could see these as kind of mix and match. And my feeling is that we on the peninsula should decide what we think is the right staffing with the help of expert advice, but we could either have daytime coverage by a doctor who isn't just an ER doctor, but actually can walk down the hall and take care of other patients. Right now we don't have that. Our ER doctors are there 24 hours a day, and they do not see other patients while they're there. We could have what many hospitals do, which is they have a physician during the day, but they have a physician's assistant at night, and they have doctors on call. And the doctors on call, turn up very quickly, and or we could say, no, that's not good enough for us. We actually want to have a physician there 24 hours a day. And that's what we have right now. But as I mentioned, our current physicians who are in the ER don't cover the rest of the hospital. And that's unusual. Usually they do in other ones. And all of our, no matter how you configure your emergency room services, you can also take advantage, and St. Andrews doesn't really enough right now, of telemedicine. So you can actually do consults with surgeons at, trauma surgeons at Mass General or Maine Medical or University of Pennsylvania. You can be talking to a neurologist, you can be talking to a cardiologist. They can see you, they can see all the real-time data, they can look at the patient, they can help the local physician make good judgment calls. So essentially, what we, after looking at all these other hospitals and looking at what they do and looking at what we need, said, together is, well, these are all things we need. We need here on the peninsula. We need family care, women's care, pediatrics, and geriatrics for both year-round and seasonal visitors. A lot of the seasonal visitors I interviewed said, I can't get a doctor when I come here for the summer. I call and they say, I'm sorry, we're not taking any new patients. So right now, we're not providing services for our summer people. We should be restoring outpatient surgery and orthopedic surgery, which is the biggest moneymaker. What everybody says is, oh, well, you've got to have outpatient surgery and you've got to have orthopedic surgery. And we used to have a great orthopedic surgeon who came up from Brunswick, who used to be the Red Sox surgeon. I think some of you may remember him. And, you know, there's no reason why we can't get somebody like that back again. And we used to have great visiting clinics. People would come, specialists would come for a day every week or a day every 2 weeks, and, you know, they would see all the kidney patients, or they would see all the urology patients, or they'd see all the cardiac patients. And it was great because you had a very good specialist who was right here for you. We need, of course, 24/7 imaging. We need to expand our small infusion center and restore chemotherapy to it. We definitely need more behavioral and mental health services, a big issue for kids as well as adults. And we've got great physical occupation and speech therapy, and we need to build that up, and boost it up, and make sure that we're recruiting people for it. And one of the recommendations that Ralph and Scott made was, why don't you have a geriatric center of excellence? You have all these old people here. And one of the things that we realized is not only do we have, you know, our whole population is aging and we need geriatric care, but we have world-class doctors in that area. Chip Teal in Damariscotta has been setting up his elder care services, and, you know, people stay at home and they're observed, or they live together in a home. So there are all kinds of great opportunities we have here to really take advantage of that. And of course, we need to expand our home health services, which have been recently cut back. Now, as Jane said, we have visited these 11 hospitals, and in addition to all the services that we just listed, one of the things that really impressed us about all these hospitals is how creative they are in coming up, looking at what the needs are on their peninsula, and then coming up with things that really help. So, for example, at Mount Desert Island, they have invested $300,000 in a mental health clinic, and they have 4 psychiatrists on that small island and 4 or 5 social workers, and it's full. And the reason they did that was because their doctors, their primary care physicians, said, you know, 45% of the patients we see are depressed, and they're not getting better. And so they decided, well, we're going to invest in this, and we're going to actually try to nip it in the bud and make this a proactive thing that we're doing. So they've been really ahead of the curve there. One of the things we've seen in a number of these hospitals is instead of having a separate urgent care clinic, what they do is they extend the office hours of the primary care physicians either early in the morning and or in the evening, and they allow anybody who doesn't have a primary care physician, you might be uninsured, you might not have a physician, you might be visiting, you can go and see a nurse practitioner typically who will take care of you. And so if it's not an emergency and you've got a bad sore throat or a flu or, you know, a sprained ankle or something, you can just go for $70 and get it taken care of. Now, wouldn't that be nice? We used to have an urgent care walk-in clinic on the peninsula. And it seems to me that we could do that again, the way many of these hospitals did, by just combining it with our physician's practice and using the facility that's already there and extending the hours with mid-level professionals. The other thing that many of the other hospitals do to keep their beds full so that they can be earning more revenue is they actually recruit patients. What a concept. So, you know, they call around to other hospitals and they say, we have beds available. Do you have somebody who's recuperating, who needs a great place to rest and recover and get good therapy? We have 5 beds open. And they'll make calls every single day and they fill their beds. So that's something we could be doing as well. One of the hospitals has free van transportation. So if you are it's not easy for you to get around, you don't drive, they actually will come and pick you up at your home and make sure you get to your doctor's appointment. And the gentleman who does that is very, very personable, and he's very interested in people, and he finds out everything about people, and then he tells them, oh, well, you should find out about this clinic. We have, you've got your mom's diabetic, make sure she goes here, etc. So he's basically building their business as he's driving people around. And the convenient walk-in hours, I forgot to mention that at Bridgeton, for example, where they did this, they found that they were seeing 6,000 patients a year that they wouldn't otherwise have seen, and over 20% of them actually became regular patients of their primary care physician. So it wasn't a substitute for people who were already coming in to the regular doctors. It was unmet demand, and I'm sure that's true for us as well. The other thing that the labs do at CAD up in Greenville is they actually send their lab people out to all the nursing homes in the area and do blood, collect blood work and other samples and bring it back and do lab work for them. So they do house calls. And all of them are focused on affordable care. So the idea is not to charge you whatever we can, because we don't do very many of them, so we're going to charge you more for it, but to actually make sure that the cost of every service is competitive. You shouldn't have to pay any more to go to St. Andrews than you do to go to Midcoast or any place else that you could get that service performed. So, and then patient advisory boards. Some of these hospitals have very active patient advisory boards who give them advice. They look at the letters they get, the bills they get, they say, I can't read this. Make the type better, make it easier to understand, change it. And they also advise them on new services that they need. Some other services. For seasonal visitors and residents, I mentioned walk-in hours. In Blue Hill, they've actually got a program to become the primary care physician for their summer people. So for some people, instead of the physician in New Jersey being my primary care physician, I am so taken with the guy that I see in Blue Hill that I basically do everything there in the summertime. And then he refers me to doctors when I go back in the winter. And then summer camp outreach, again I think it was in the Bridgeton area, right, that they have teas for all of the camp nurses ahead of time. They introduce them to all of the programs they have at the hospital, and they have special slots set aside for campers, so that, when 100 kids turn up and they all get the flu, we know where to take them and what to do for them. One of the things we were most impressed with were the wellness programs that some of these small hospitals have. And at Holton, for example, they have a wellness program, as Maine Health does, for their employees. So a wellness program is typically a situation where, you get proactive care and you get checkups, and then they say, you really could lose a little weight, or we need to get your blood pressure down, or whatever, and they reward you. You get points, you get extra money. At Holton, they get a $100 if they lose so much weight. And so the results are very, very dramatic. As the more and more people get involved in the wellness programs, the lower the costs, the healthier people are. But the problem is that most of these wellness programs are employer-based. So it's, your employer can maybe provide this as part of your insurance. What Holton is doing is they tried it out first with their employees, and then they said, why don't we roll this out to the community? Why not have a wellness program that everybody can join? So think about that. Instead of just paying for services at St. Andrews when you need it, what if there were a St. Andrews wellness program and we pay, a little bit a year, and we get these proactive services, and we get benefits and bonuses, maybe good Y membership is connected to it. At Rumford, we saw an amazing cardiopulmonary rehab set up where cardiac patients come in and do workouts 3 times a week in a group. But what's particularly interesting about it is not just a gym with a coach and a group of people doing exercises that are good for them, but they take their blood pressure and their EKGs before each exercise and at the end of each exercise, and they transmit that information in real time back to their physicians, which means they can change their meds very, very quickly. So what they find with both cardiac patients and respiratory patients is that the doctors love this program because they're getting all this data from their patients' workouts that allow them to fine-tune their proactive care. And then local veterans clinics are something that you can actually do and earn money from. And then one of the things that really impressed us was the extent to which all of these little rural hospitals have set up very vibrant linkages with big urban hospitals, many of them. So for example, the University of Pennsylvania Perelman Center sends teams of 3 to Mount Desert Island every 2 weeks all summer long. And they work in the ER at Mount Desert Island and they train the local people. And then in the wintertime, the nurses from Mount Desert, Bar Harbor, go down to Philadelphia and work in the city ER to get exposure. At Lewiston, they run they have a connection with the trauma physicians at Mass General. And again, they have a very vital, vivid exchange. And then many of these hospitals are actually residencies. So these urban hospitals that have young doctors, interns, who want to learn how to be a rural doctor, they need a place to go and practice and learn. So that's how they feed their pipeline of doctors and nurses. So that's what's possible. We basically said, look, this doesn't make sense. We need these services. We can afford these services. So why are we in the situation we're in? And what we all kind of looked at ourselves and said, well, the problem is the way we're being run, the governance structure. So right now, as you're probably familiar with, thank you, we have a board. The St. Andrews board is actually a single board of St. Andrews, Miles, and Lincoln County Healthcare. There isn't a separate St. Andrews board, essentially. And so the people who are making these decisions are in the minority. There's only 8 of them out of the, 19 people on the board who actually live in Boothbay and are not employees of Lincoln County Healthcare. So the reason we're in the situation we're in is that even if all 8 of those people wanted to keep the hospital open, they'd be outvoted. So we have a governance problem. We need to fix it. So it's actually not enough, we feel, for Maine Health to say, or Lincoln County Healthcare to say, okay, you've convinced us, we'll leave it open. Because we think that leaving the hospital in the hands of Lincoln County Healthcare is just going to be a delaying tactic. They might be convinced to do it because we're so noisy and obnoxious, but that would be a temporary state of affairs. What we want is to change the governance model. We think that we should be back to where we were, where we had our own board that was responsible to the community. And we don't think that's too much to ask. It makes a lot of sense. So we want an independent board elected by the people in the Boothbay region, just the way we elect selectmen. And it should operate in accord with the state charter and means that it has to serve the interests of the people in the community. We want our hospital, of course, to stay open, and we want more affordable, convenient outpatient services, and we think we deserve that. So what are the next steps? And then we're going to open it up to your questions, and I hope you'll write some down on those cards if you don't want to go to the mic or speak out. First, we need to maintain and enhance community support. We need to get this message to as many people as possible. Hopefully a lot of people will watch Channel 7. We'll keep talking to folks in both large public meetings like this one and small living room settings or you know, neighborhood gatherings. You will be voting, all of you, in the town meetings. The next one is Southport on Monday. You will have an opportunity to vote on a referendum to keep St. Andrews open. You will also have an opportunity to vote on the funding for the ambulance service. We recommend that you vote for supporting the higher funding for the ambulance service, because I don't think we have a choice. I think we need to make sure that we have that capability available to us, and I hope we won't need it. And if we don't need it, then what Scott Lash has said is, then we won't come ask for the money, you know. So our taxes wouldn't go up. But we need to, that's certainly one of the important next steps. And then we need to regain community control by changing how the Board of Trustees for St. Andrews Hospital Corporation is elected, and learn from the best practices that we've been gathering at other hospitals and begin to redesign our hospital. And one of the great things is that the executive teams that we've met with have all said they would be happy to come and present to our community and work with us to help do that design work. So we have 11 hospital teams that are ready to roll up their sleeves and help us be the best we can be, take advantage of everything we've learned from them. So we want to make St. Andrews Hospital the driving force in promoting health and wellness on the Boothbay Peninsula, make it the integrated part of a broader network, which includes the Y, includes the Land Trust, includes everything else that we do in terms of health and wellness. But we want St. Andrews to be at the core. So that's what we've come up with. Now we're ready to get into discussion. I hope you guys will stick around long enough. I know it's been a long evening, but we'd like to get some good back and forth discussion. So I'm going to turn it back over to you, Chuck, and we will run around and collect them.
I'd like to say thank you to Patty for a very excellent presentation and all of the hours of work that she and the work group have put into what you folks have just seen. We'll open it up to questions. Jim has a microphone in the back, and I'd ask that you raise your hands, and Jim will bring the microphone over to you. All I'd ask is that you keep the questions brief, and we'll choose from the panel who might best answer your questions.
Thank you, Jim. My name is Phil Smith, and I've been a resident of Southport for some 40-odd years. Summer resident for a while, but then retired for 22 over there now. And I spent my life in the nonprofit world. And mine is a question. I've had this conversation with Smith Climo. My question is, two things have prompted me to stand here tonight. One is a letter that Jim Donovan sent out, a white paper here a little while ago, in which he talked about the viability of St. Andrews. And then I read the annual report, and I'm sure you've all read the annual report from South St. Andrews. And in it, it talks about, this is a nonprofit with a profit listed for the year ending September 30, 2011, $424,036. That's a nonprofit. I'd like to be in a nonprofit that made that kind of money. And then I looked down in the admission statistics, which I'm sure you all have looked at one point or another. And the average occupancy rate went from 34.82% in 2009 to 41.42% at the end of fiscal year 2011. Residential care days up by almost 1,000 numbers. And things of that nature. Obviously, there were inpatient surgeries and outpatient surgeries. They're down because of the things that had taken place. And in Jim Donovan's letter, he talked about the viability of St. Andrews. And when you look at these numbers, and all the nonprofits I've ever worked for, you've had more than 1 year. You compared, you had two, you would be 209, 210, 211. To keep it, you could make comparisons. They do that with statistics, but not with the numbers up here. And I think what I'm hearing is that St. Andrews will, Lincoln County Health will not give out their financials. And I don't see how that can be. I think that they have a moral responsibility to present a record of their financials over a period of time. And having lived here long enough, I wonder if there's not another agenda in the background besides finances. And I think it would be a very interesting case to try and figure that out, compare values, compare systems, compare some of the conversations that have taken place with your doctors, with their doctors and things around here, that there isn't this second agenda, that money is a mask. And people want to play. Lincoln County Health wants to play. Jim Donovan, good man, but Maine Med put him into Brighton to take Brighton down, and they brought him up here to work on Miles and Lincoln, Miles and St. Andrews. And I just think it would be a little pursuit to put a little pressure on. There's been very little in the paper or very little reports about these issues, about the finances. They talk about viability, but they don't give you the numbers, their numbers. And I think it just would be important to do that. Thank you.
Ralph, can you bring any light to the comments that he said? I know that's probably easier for you than any of us.
Well, I don't know if you can really respond other than in many respects I agree with everything that was said. I think in retrospect the community has lost trust in Maine Health and Lincoln County Health. That's a difficult thing once it's gone. In order for this thing to work for this region, there needs to be a change in sentiment, and the only way that's going to occur is with complete transparency. And although there's no legal obligation for Lincoln County Health to share their financials, I do believe, as was stated, that there's a sort of an implicit community need and reason to better understand the numbers. Very recently there was an article that was written that really brought out very different numbers than some of the ones that we've seen, and I think those differences really ought to be reconciled through some open dialogue and sharing of information.
I'd like to say something very specifically in answer to that question. The white paper that Mr. Donovan presented said, quote unquote, that the hospital lost $2 million in the 12 years including 2012. He did not cite where that information came from. It turns out that there is a requirement for any not-for-profit to file a report with the Internal Revenue Service that does include information as to both its revenue and its profit. So we got those numbers for the 11 years that were within his 12 years. We don't have the 2012 number yet for the reason that that IRS form, the 990 form that every not-for-profit has to file, isn't due until tax time this year. So the 2012 number that was included in his $2 million loss is not yet available to us. But we had 11 out of these 12 years. Now the interesting thing is that if you look at those numbers, they add up to a profit a profit, a net profit, make sure everybody gets that, net profit of $6 million that St. Andrews earned in the 11 years out of the 12 that he specified. So the only way in which his number of a $2 million loss over that 12-year period could happen is if St. Andrews lost $8 million last year, which of course it didn't do. Now, the interesting thing is that on the one hand, there are the IRS reports, which are publicly available, or there is this report from Jim Donovan that does not cite any source for his $2 million loss number. I don't know where it comes from, and I'm very confused by it. And I know that St. Andrews did not lose $8 million last year.
I think basically we know what we want and we think we can get it, supposedly. However, who made the initial changes at St. Andrews Hospital? Who dictated that we close all the departments that were closed, that we lose our operating room? Who allowed our operating table to be taken from the operating room before Jim Donovan even bought it? You know, these are things you folks have to know. I mean, the only thing I can think of is, or the only way that this can any way be solved is through legal. And there must be a legal course here. If what Tom says is correct, I mean, false information being given out, or no information being given out isn't right. I mean, it just isn't right. What can we do legally? What can we do? Because we all know, we all want what is being, you know, what you've projected. It's the right thing to do.
Oh, okay. I was going to steal that mic back from you, but I guess I didn't need to. First of all, I'm not a lawyer, so I can't tell you specifically, but there are legal avenues, and they're being pursued. And I think it's important to continue to pursue those legal avenues because that may be the ultimate recourse if Lincoln County Health and Maine Health choose to stay the course. If things change, it's going to have to be through their decision, their willingness, and if they're unwilling, then the legal battle, which can be an extensive one, a very expensive one, would have to be fought. So there would have to be a willingness for people in this region to somehow support the funding for what could be a very expensive legal battle. That's an issue that's going to be before this community, potentially, because I think that decision hasn't been made. I think there's been a lot of work done to see what alternatives and options are out there, but at this point, that's a forward-thinking decision. Yeah, and there was that meeting with the Attorney General, which things are being assessed right now, and I don't think anybody knows exactly where that's headed.
Yeah, as Ralph mentioned, there was the meeting with the Attorney General, and from the debriefing that I got, folks were feeling very positive about the information. The information was going back and forth between the group from the task force that was there as well as the AG, and information was flowing freely between the two entities. I think that the AG has also noticed that we've had a few difficulties down here as well. I mean, Attorney General Mills put forward the bill, and Bruce McDonald has co-sponsored to have the meetings opened up, to have minutes opened up to the public of any entity that accepts public funds. In this case, it would be Medicare and Medicaid. So there are folks out there that are seeing that we're having difficulties. I mean, we asked many times for minutes and bylaws and didn't get anything. They're a private company. They can do that. I'm hoping the law gets changed. But right now, I'm hoping Attorney General Mills sees something, grasps a hold of it, and comes to our help.
We've got one from the floor.
I'll just read it out. How do we change the board, how the board is elected? Who would like to address that one? Tom, you've thought about it?
It's probably what I spend most of my time at. They're really, in answer to the question, you know, how did this happen? Who was in charge? Who was making things happen? Well, that really gets down to the question of, you know, Jim Donovan keeps saying that nobody owns St. Andrews, but the fact is that even a not-for-profit like St. Andrews is owned by whom? Well, it's owned by members of the corporation. Who are the members of the corporation? Well, they're essentially, for a public not-for-profit, they're the equivalent of the shareholders that own, quote unquote, a for-profit enterprise. So members of the corporation, quote, own St. Andrews. In what way? Well, they elect the directors, the trustees. Well, what do the trustees do? Well, they hire the management. And it's the management who did all these things that closed the hospital operating room, removed the beds, et cetera, et cetera. But that management is, ostensibly at least, reports to the Board of Trustees. Now that Board of Trustees, in the case of St. Andrews, about 50% of it is the management. It's either Jim Donovan or his boss at Maine Health, Jim Caron, or it's one of the doctors working at St. Andrews. So about that's the accusation that has been made, that board is packed. About half of it has a strong conflict of interest in the sense that they're employees of the hospital. Now, getting back to the question of what could be done. Well, one thing that could be done would be to have the members of the corporation be the members on the peninsula. Those people could vote to elect the trustees, just as currently they elect the selectmen for their various towns. There are two ways in which the change to the bylaws, the change to the Articles of Incorporation could be made that would require such a vote. One way is for the Attorney General to intervene and insist upon a change in the bylaws. The Attorney General is free to do this. She's the chief law enforcement agents in the state. She's responsible for seeing to it that the state charter is honored by every corporation that is chartered by the state. And St. Andrews has, as it's in its Articles of Incorporation, that it's in business to produce a, quote, hospital. So it's contrary to the very mission of the existing not-for-profit corporation to close the hospital. It can't be done legally. So the Attorney General could also notice, I think, if I were the Attorney General, certainly I would notice, that the board has been packed. In short, when Jim Donovan refers to my board, he's right about that. It is his board, in the same way that his car is his car and his house is his house. My car, my house, my board. He owns them all as a consequence of the fact that the non-employees that report to Jim Donovan on the board have functioned largely, they're all good people, I'm sure, but they have allowed a situation to arise in which they have functioned as a rubber stamp for anything he wants to do. And one of the things he wants to do at present is to close St. Andrews. So he's doing it, and it's going to close on October 1st, unless something happens. The two things that could happen are the Attorney General could intervene, or there could be a meeting of the Board of Trustees of St. Andrews. There still is, by the way, a Board of Trustees of St. Andrews. It happens to have one voting member. That Board of Trustees gets elected by the corporation, and the corporation has one voting member, which is Lincoln County Healthcare. But having elected that board, the board exists. They could, at their next meeting, put on the table a vote to change the Articles of Incorporation such that every member of the community elects the trustees of the Board of St. Andrews. They could also, by the way, somebody could insist that anyone who has a conflict of interest should recuse themselves from voting. Well, who would have to recuse themselves? Well, first of all, half the board would have to recuse themselves because they work for Lincoln County Health. Second, there are a lot of people that do not, even in their own minds, represent the interests of people in the service area of St. Andrews. They should recuse themselves. That would leave the 7 or 8 people who are residents of the peninsula to vote, if that happened. And by the way, the chances of this happening are pretty small, but it could happen. It also could happen that those 7 would wake up and realize that they should not function as a rubber stamp for Jim Donovan. They should just vote what they know is right. In fact, what they should do is what Jim Donovan already says exists. He said it in his white paper. He said, well, there's already community control. Well, that's great news. He thinks that we already control the fate of St. Andrews, so he can't possibly be opposed to it. Nor can anyone else on the board be opposed to it. So this vote would have to pass. And if it passed, it would be the end of the need for any meetings like this, because the hospital would have a board of trustees that was elected by people in the community.
As I understand it, the Board of Trustees represents Miles, represents Cove's Edge, and represents St. Andrews Hospital. These members are self-perpetuating. If someone leaves the board, then the board comes up with a recommendation to Maine Health, and Maine Health acts on it and appoints it. Our thought is to change the bylaws so that St. Andrews has its own board elected by the people in the 4 communities it serves. And as an interim, we would, before the election process can take place, we would have an interim board to keep the process going until the properly elected members could be sworn in.
Got another question over here? I think so.
I'm a little late on this, getting into this, and this is a very interesting program tonight. What am I doing? Okay, there we go. Anyway, I'm a little late getting in here. I've been keeping up via the paper and through Tom and Patty and other people. All of this stuff, all of this business of having them change their mind and so on is not going to happen, in my opinion. They're going to have to admit their mistake, and that's awful hard to do. However, last week, Patty called me and said, can you get some signatures for this letter? So I went around in my neighborhood and different places, and I got 3 responses. Heck yes. No, I'm not going to sign it, with some other reason why they weren't going to sign it. or I'll sign it, but I don't think anything's going to happen. I think you're wasting your time. We've got to keep the fire going. We've got to have I mean, this is great, but not many people who are undecided or who we need to support are going to sit and watch this on TV, this meeting tonight. But we need bullet points. We need to have quick, hard-hitting things to keep our friends and neighbors involved. Plus, all of us know people who live in New Jersey, Texas, and wherever that own property here. We need to call up, make a phone call, and have something like the letter to have them send in also, so that we keep the fire under this, so that Maine Med and all the rest of them realize how serious and excited we are about our hospital.
I will say, and I think I can speak for the volunteers, that this isn't the only thing that they have planned. I know that there's a website up that's on the Boothbay Register site, and there's articles being submitted to that all the time. Jane, your letter is linked to that, isn't it? It is. And Jim, it's also linked to the Town of Boothbay's website. Okay. So things are being worked on behind the scenes, and like I said, lots of good new information is put onto the Register's website by the volunteer group, and the hours that they've put in on this has just amazed me, and they deserve all the thanks in the world.
This is really a question that goes back to the original question that was asked. I'm curious about this idea that the money is just a front for some other purpose, that they are masking something else in trying to get rid of St. Andrews. Did that resonate with anybody? Does anybody know what that could be? Okay.
Unfortunately, all of their meeting minutes are private, and we're not privy to any of those, and they won't release them to us. Right now they don't have to, because they are a private company. Hopefully something will be coming from the AG's LD, I think it's 689, where she's saying that all the minutes, as well as the meetings of any hospital that accepts public money, should be open to the public. And I support that. They're receiving our money. They should take our input. The only thing that we know right now is what they've told us. And I can say we don't agree with them at all. Just what they've told us.
Hi. You know, I remember reading in the paper about 3 or 4 years ago, I might be off on the time, that what they wanted was a brand new hospital up on Route 1. And I bet that has never changed. If they can close us, then they can close Miles, and they can put in a brand new hospital that we're all going to pay for up on Route 1.
We had another question here from the audience, and it says, can we get back the equipment and services they stole from us? I do know from what I've been told that, and take it for what it's worth, that they wouldn't transfer anything that was donated to St. Andrews outside of St. Andrews. However, I do know of one piece of equipment that was donated to St. Andrews that they bought. They gave the person, the organization that donated it to them, a check, so that they now own that, so they can do whatever they want. they won't like to hear this from me, but if they've done it with one piece of equipment, I'm sure they'll do it with more.
I said, so, you know, what is the feeling of what's going on at the hospital with Lincoln County Health? And I got talking with the nurse, and she was very verbal. She said, well, she said they've come in and they've taken swing beds, not the older ones, but new ones, and I happen to know that St. Andrews Auxiliary has bought a number of swing beds for St. Andrews. There was also an imaging machine not an imaging machine, a sonogram machine, I believe it was. And the nurse said they said they were just going to borrow it and they'd be bringing it back. And she said that was well over a year ago. There were other things she told me, but at that time I wasn't as wound up as I am now. But things have been removed. I mean, they have, and I don't, as far as what the hospital has given, I mean the auxiliary has given, I don't know every single item, but you can find it out. If you go to the medical building, they have a record of everything we've given. And I think I gave you some information on that. But yeah, things are gone that we bought. And as far as I'm concerned, I was told that the emergency room operating table that Lincoln County Healthcare bought back or paid us for, because the auxiliary bought it, I have sort of first-hand information that the bed was already at Miles, the operating bed. That's stealing, as far as I'm concerned.
I have to be honest. If they own the equipment, they're free to do anything they want. No, I'm talking Lincoln County Health. Unfortunately, that doesn't make it right. It doesn't make it moral, but they do own it. And they're free to do with it as they wish as a private company. Still doesn't sit right.
And if you look at the legal position paper, Julius goes into some detail on this, where contributions made to St. Andrews Hospital are for the beneficiaries of the area and cannot be used. They couldn't be transferred to Miles unless there was a monetary exchange in which Lincoln County Healthcare bought those. So there is a bit of an obstacle there, but I think Lincoln County Healthcare heard that criticism in the position paper and has resulted in the purchasing of some of those pieces. But then they're purchasing those pieces from St. Andrews trustees, and they're the same people.
I'd like to add to this comments on this subject. If you're running a not-for-profit, you get two kinds of gifts. You get restricted gifts and unrestricted gifts. Anybody who's running such an organization much prefers getting unrestricted gifts because you can do anything with them. The restricted gifts are restricted for some particular purpose. And whenever we hear this holier-than-thou talk from LCH about how they never break the law, and after all, if somebody had a restriction on a gift, why blah, 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 blah. That's true, probably, my guess is, for restricted gifts only. But if in the event you gave money to St. Andrews that was not, quote, restricted, which if they had any brains at all, they would have asked that you do that, because as I said, running the hospital, you'd much prefer getting unrestricted gifts than restricted gifts. Anything that was, for example, if they ask you for money for a hospital bed, you can either write a check that says, this is for a hospital bed for St. Andrews. That's a restricted gift. Or you can just say, here's the money for the hospital bed, and write a check to St. Andrews. In which case, the St. Andrews board is free to do whatever they want with that money.
We have another question from the audience. Is there any consideration or possibility of affiliating with another hospital or healthcare organization, i.e. EMMC? Ralph, can you speak to that at all?
I don't believe that there has been any formal discussion at any level regarding affiliation with any other organizations at this point. Clearly, that's something that can occur, but I don't believe it's occurred to date.
Certainly, we've asked this when we've visited all the other hospitals. You've asked who you're affiliated with, how does it go, how does it work, what do you think? And I would say we came away with the feeling that the other two networks in Maine, Eastern Maine and Central Maine, are both much more supportive of small rural hospitals than Maine Health. Maine Health seems to have a strategic direction of very large metropolitan centers with just family care centers out in the communities. And the others seem to want to distribute more health care out to each little region with their own self-standing hospitals. However, in talking to the CEOs of those organizations, they said, well, of course, you couldn't become part of another network until you extricate yourself from being part of this network and being part of Maine Health. So I think that would have to be the first step. And then I think because we've been burned, we probably would be more interested in paying a different kind of an affiliation. There are two kinds. There's, we pay you for services. You know, we want your billing services, we want your electronic medical record service, you know, we'd like some of your doctors to come and work with our patients, and we can pay for that. Or you can do what we did at St. Andrews with Maine Health, which is you sign a piece of paper and you become a wholly owned subsidiary. And I think we'd probably want to go the first route and maybe then kind of test the waters and see if it makes sense to jump into bed with somebody else.
I hate these things. You know, back in July, we were a bunch of startled, offended people. Didn't know a whole lot about health care. We knew we wanted to stay healthy and live forever. But that was about it. And what's happened is that a number of us, Dan's going to live forever, a number of us, quite a large number of us have learned an awful lot. And there's still a lot we don't know. But one of the things that we found in our group is that it's almost impossible for a small hospital to stand alone in these days. You can't do it. So affiliations are the way you have to go. But the advice that we keep getting is that you have to look at the agreement, make sure that it fits for you, and then don't go to sleep. A lot of us went to sleep. We just figured they were doing their thing, and they had us in mind, and it was all going to be okay forever. And you can't do that. You've got to invest time and effort into defining what you need, and then you have to use it. Because if you don't use it, it's going to go away. And Jane keeps asking me to tell my story. When you pay your taxes in Boothbay Harbor in another couple of weeks, remember that the check you're writing is the size it is because we have a huge nonprofit that's not paying real estate taxes. And every time I write my real estate tax check, I'm buying a part of that hospital. So remember that when you write your checks next week. You own it.
I would like to add to that another thing that was stunning for our group is that we never saw another business model where we had a middle management team like Lincoln County Health. We've looked at hospitals that affiliate, you know, with other hospitals, Maine Health, say St. Andrews, but not with this middle management team with paying exorbitant salaries to run it. So that was, if we do affiliate, we need to look at this kind of thing too, so.
Tom.
I don't know how you use this thing, but I guess we just talk into it. Okay. I was just wondering a couple of things. Number one, when this affiliation took place in the mid-90s, there was a definitive agreement which said that this would remain, St. Andrews to remain a hospital until the board of St. Andrews determined that it was no longer successful as a hospital and should be turned into a smaller facility. Now, then the board lost its identity completely. So, in my opinion, it could no longer give that opinion to Lincoln County Healthcare. In other words, if the board of St. Andrews has to make the decision that St. Andrews is no longer needed in order to trigger what they were trying to do, and then they pack the board, they can't get that decision made at all. And I intend to write the Attorney General later this week about that. The other question I've got is, looking at the adverse effects to the town of Boothbay Harbor, why doesn't the town of Boothbay Harbor simply take the hospital by eminent domain? I know nothing about eminent domain, but it seems to me that it might be something to look into.
I would say, Tom, that if Boothbay Harbor was to entertain that, that'd be something that would need to be brought to the town of Boothbay Harbor. And I would think it would be very expensive.
There's another question. Last question.
The question is, what about Julius? Isn't it time to get him involved in our legal counsel? At least initiate a lawsuit. Jim?
So obviously the task force has brought on Julius for his legal advice. One of the avenues that we all know that sits out there is litigation, and essentially there's a major obstacle here is that the task force is by interlocal agreement for towns making decisions kind of as a committee, and the way we treat the committee is similar to a subcommittee of the town. Well, they follow the same rules that they'd have to go back to that governing body that makes the decisions about litigation, and that would be the selectmen. So you would need, in order for the task force to file suit, you would need the approval from 4 different boards of selectmen. That question has never been posed to any of the selectmen, but then again, it's also a difficult question to ask, because you're probably talking about, and I'm not a lawyer and I don't figure out how much they cost, but probably hundreds of thousands of dollars in litigation. And that would be a huge uphill, upfront cost to a suit that we're not sure we could win, not because we don't have a good case or not because we haven't put together good arguments, but because we would be up against a formidable opponent. We have a lawyer because the legal position paper that we put together makes a really strong argument, one that we've delivered to the AG, and we've proven in our opinion, we have proven that the AG has an ability to weigh in on this. So we've given her what we think is the open door for the ability to weigh in on this, and through that paper and the iVantage report, we've given a case. Hopefully, the AG, as the highest lawyer in the state of Maine, can do that for us. It just still doesn't it still doesn't close the door to other litigation from other people that can show standing. And the task force, I think if there was another group out there that could show they had standing, had a potential case, I think the task force would hand over all their findings to them. The question here is, why do we have Julius? You know, the first thing you do when you think you may be in a position where you have where you need to figure out if you've been harmed, first thing you want to do is hire a lawyer and find out what your rights are. That's what the task force did. We hired a lawyer, we found out what our rights are. And honestly, if we didn't have rights in this, Julius probably wouldn't have taken us as a client. He took us as a client and investigated the story and came up with a really strong legal position paper. And certainly if the task force governing members decide that they want to go and ask their Board of Selectmen for that permission, I think that still needs to be the final question. I think at that point you've knocked down every door, and the selectmen know that they also have the backing of the people for that question. Is litigation the only open door, and is it necessary? So I can't answer the question, but that's why we have Julius. He's been instrumental so far. Can I say one more thing too?
Jim.
So this isn't a question, but it's you know, I just take it as a little bit of a public comment. So I've been working for the town of Boothbay for just a little over 2 years. I've been doing municipal government for just about 5. But I've always been one of those people that gets knee deep in the community that I live in. I just happened to move here and starting to get into being involved in the community, and this crisis comes upon us. And I'll have to tell you that there are some communities that when they feel like they're harmed will grab their pitchforks, light their torches, and the mob comes out. But in this community, what you had was the most intelligent people that I've ever seen conglomerate, put their skills together, and really come up with a knowledgeable and thoughtful approach to thinking this out. And it's a credit to the elected leaders, credit to the key volunteers, it's a credit to the people that show up at 8:30 at night on Tuesday to get involved in this debate. So I just give yourselves a lot of credit for the way your community has handled this service change, because it's not something that every community is dealing with, and it's something that other communities would have dealt with differently. And irrationally. And I think that's what Maine Health and Lincoln County Healthcare expected, was an irrational knee-jerk response. And what they got was a really educated community group that wants to discuss this, that wants to figure out what is the real impetus here, what is the real reason for this happening, and can we figure something out? Congratulations to you.
Yeah. One last thing before I close this up. I do want to thank all of the volunteers for all of their hours of hard work and dedication. The information that we have, the information that we got for the iVantage, for the Gabara Group, for Julius, we wouldn't have that without these volunteers. And I want to say thank you. I also want to say that we are looking at all the options. This group has done a great job putting together this presentation, outlining all of the facts that were in the iVantage Gabara Group report. I've had conversations with people that have told me that that report says exactly what we wanted it to say. I wouldn't say that. It's not telling us what we told them to say. They looked at the information and gave us their report. The Navigant report for Lincoln County Health and Maine Health is over here. The Ivantage Gabaro is over here. We need to get back to the table, sit down, work this out for what's best for this community. I need, the task force needs, the community needs Lincoln County Health to come back to the table. Right now we're not talking, and that's not helping anybody. I'm a little frustrated with that. We need them back. We need them back now.
You are all fighting a very tough battle, an uphill battle, but it's still very much of a battle. I would urge everyone in this room to make sure that your friends and neighbors vote on this issue when you have the opportunity. I have to tell you, having met with Lincoln County health officials as part of the work that we were doing, they believe that the majority of the people on this peninsula support their decision. I don't happen to believe that based on all the people that I spoke to, but the most real way that you can demonstrate how you feel about it is through your upcoming vote in the 4 communities here, so I would urge everyone to get out and vote.
Thank you. I would like to say thank you to everybody that came out this evening. This is a good group, and we appreciate the questions, and we will keep working on this for you. Thank you.